This is a 10-bed pediatric ward at a private nursing home, but 8 of the 10 beds are empty. And this is the same story in private nursing homes like this across Kolkata, and we are told across the country. Till 22nd March, this 50-bed nursing home was full. But as the lockdown rolled in, occupancy fell to just 12 patients now. Usually, occupancy is 100% with a waiting list. But all that now seems history, and the owner is wondering how long she can keep the shutters up at her 40-year-old facility.
Patients are not coming because the doctors are not attending their chambers, and also the patient party are also panic stricken, and there is no transport at all. But government is saying that we'll have to give the salaries, we just can't deduct anything, and how is it possible, I don't know.
So if this continues,
then we'll have to close down.
This is a promotional video for a 300-bed hospital. Today, with bigger overheads and bigger staff to take care of, big hospitals are in trouble too. FICCI's healthcare panel has written to the Prime Minister on 25th March for help. Help they need urgently because the virus and the lockdown have meant almost no patients coming in for surgeries, footfalls at OPDs down 70 to 80%, and income down 50 to 70%, putting private hospitals in total jeopardy.
The hospital has 10 to 15% of EBITDA, PAT of 3 to 5% PAT. With that money, we have no cash flow. So as a result, we already have walked into CCU. We probably will not be able to pay power wages for May, and we will find very, very difficult to pay salaries unless government comes up with some kind of fiscal support at this time immediately. We need oxygen ourselves. If we don't get it, we are going to get in serious trouble.
We are the care providers, or the so-called warriors, as the Honorable Prime Minister has called us. If this goes on, then the healthcare worker is not available to provide healthcare at a time when you need him or her to do so. And that's a frightening scenario.
At this nursing home, again 50 beds with just 12 patients at the moment, staff say their chairman has promised full salaries for all. But there's no escaping the question, for how long?
Always doctors are not available. Patients are worried. So suppose one patient is coming for admission. The first question is that, is there any corona patients admitted here? So they are also worried. That will be an issue. But I have got a strict instruction from my chairman that full salary will be paid for the staff. At the current scenario, we will pay the full salary. So don't know what will happen in the future.
A terrible uncertainty gripping the private healthcare sector, which has at least 4,000 hospitals, 9 lakh beds, and 40 lakh people, all warriors in the war against COVID. 60 to 70% of India's healthcare is provided by the private sector. And if the private sector goes into ICU, then the battle against the virus has already lost a huge flank of its army. They need help. The government needs to step in. In Kolkata, Monideepa Banerjee, NDTV.